Prostate cancer is very common in men after the age of 50. So all men above 50 years of old are advised by us to do a medical checkup blood test called PSA. PSA is abnormal, you might have at risk of having prostate cancer and you should consult a doctor. Normally, we will advise patients with a high PSA to undergo a MRI of your prostate gland. Based on the MRI of your prostate gland, we might advise you to undergo prostate biopsy. In Island Hospital, we use a technique called transperineal MRI fusion prostate biopsy. Traditional way of doing prostate biopsy is through the rectum where there is an incidence of infection. In transperineal route, we do the biopsy through the skin where there is no infection risk at all. We use an ultrasound to locate where the prostate is for the biopsy, but on ultrasound we are unable to see the area of interest or abnormal areas in the prostate. This is where the MRI fusion technology comes into play. We superimpose the MRI images on the ultrasound images, and now we can see clearly where the abnormal areas are and where the biopsy should be taken. Then it's a matter of simply programming our robot to take biopsies accurately from this place. The robotic arm is very accurate and it places the needle within 1 millimeter of the lesion, and we can get an accurate biopsy on the first instance itself. A lot of my patients are worried about complication of doing biopsy. Rest assured, the biopsy does not spread the cancer, and most of the time there is no pain at all, and patient only will have mildly blood in the urine maybe 2 or 3 times after they pass urine. It is a very safe procedure. The main treatment used to treat prostate cancer is a surgery called radical prostatectomy, where we remove the whole prostate gland together with the seminal vesicle. As you know, the prostate is situated in the male pelvis. The pelvis is a very narrow space and there is a lot of important blood vessels and nerve there. In Island Hospital, to perform this complex surgery, we use the divulges robotic platform. By using the robot, it gives us a lot of advantage in performing this surgery in the narrow space. The images are magnified 10 to 20 times, so we can see the minute blood vessel and minute nerve more carefully, and we can preserve these nerves and the blood vessel so to reduce the complication and recovery period for the patient. The surgery is done in a keyhole manner, so the recovery phase is very short and patient often goes back home 2 days after the surgery. The use of robot is revolutionizing surgery in urology. Nowadays, technological advancement is such that we use robot to help us to get good results in complex surgery for our patient. By using robotic surgery, it enhances the surgery and makes complex surgery easier to do, and this in turn translates to better patient outcome and better patient treatment results.